relatively post-lunch gathering. This New Frontiers in Digital Health. I have the pleasure of sharing the podium with two very, very interesting folks. They come from disparate disciplines, will bring different insights that will kind of meld together. And they'll tell you more about themselves as well, and sort of go from there. So, can we switch slides, please? So, I'm going to start off with something simple. What is digital? A lot of people think of digital as a technology, and digital is really a way of thinking rather than a technology. The digital value mark was concerned a number of different components of speed, harmonization, agility, automation, accuracy, connecting, ultimately leading towards decision making. Next slide, please. We want to escape digital Darwinism, and 80% of what we do in that space is at risk. Next slide. So, one of the things that's really interesting in this digital space is how we improve things and become more seamless and more sensible. So, we go from this whole idea from enhancement to transformation. Rather than jumping right into transformation, we have to start off with a mechanism for enhancing the way we think of what we do. We augment, we modify, and that really allows us to redefine, creating new tasks and previously inconceivable ideas are able to manifest themselves. Next slide, please. So instead of transforming the culture, why don't we insert a catalyst and put together how we push and pull. Next slide, please. Digitally advanced organizations recognize and reward cross-collaboration, cross-functional teams. Nearly 77% of digitally advanced businesses do, 34% of the least digitally sophisticated group of companies. Next, please. As an example from Nestle with their little digital acceleration team, we thought we'd throw that up in Switzerland. Next slide, please. So I'm turning this now over to the content people here. I'm here just to set the tone. In the absence of someone else who didn't show up, my apologies. So let me turn it over to Sean. Sean's company, he'll tell you more about it, just won the NASA Innovation Award of the Year. Go for it.
Thank you. It's great to be here. In just a moment, I'll show the short movie clip regarding our technology. So I'm a co-founder and CEO of Context AI. Context AI, we're a healthcare data science company that has developed novel electrodiagnostic sensors that are able to measure every sound, vibration, and electrical impulse of your body. Why don't you go ahead and press play.
California showcased a wearable biosensor array that turns the body.
This was a video that NASA made on our behalf.
Context
I'll tell you a
AI
little
from
about the
Santa
work.
Clara, California showcased a wearable biosensor array that turns the body's vibrations, sounds, and bioelectric impulses into actionable intelligence to identify heart problems at very early stages. Earlier detection of health issues could lead to lower costs and better outcomes for patients on Earth and preventative care for astronauts on long-duration flights.
Great. So we're as I mentioned, a data science firm, a data science startup company that's developed novel sensors that we're putting in clothing and our own wearable, and ultimately want to use these sensors that are measuring every sound, vibration, and electrical impulse of your body. And we do this in order to really take away from the practice of medicine and go towards the science of medicine. And by partnering with doctors, we can start measuring and quantifying not just the reporting of symptoms in diseases like end-stage congestive heart failure or diabetes, but we can start monitoring with a huge amount of data that we're acquiring from these low-cost sensors. So ultimately, a little bit about my background. I'm a physician. I went to undergrad here in the Bay Area and medical school at USC and got an MBA in finance, decided not to practice medicine. Really got excited around developing novel technology, specifically advanced medical implants we were involved in a startup for the world's co-founder and former CEO of Replenish Inc. Is the company that developed the world's smallest refillable and wireless drug pump for ophthalmology. We led fundraising for about $70 million over the last 10 years, and wound up licensing the technology for macular degeneration. Then went on to co-found another technology, medical device company, where we went after really kind of value-based, low-cost surgical tools, but it was really my first foray into smart tools and smart medicine, looking at ophthalmic surgical tools using the ophthalmology suite. I wound up exiting that company about 3 years ago, and continued on this trend personally from maybe 15 years ago when I started with startups, going after maybe in the early 2000s, it was about discovering and identifying really unmet needs in medicine that had, in creating expensive solutions or expensive devices relative to what is now compared to the wearables market. And over the last 15 years, watched politics evolve, the economy evolve, and medicine evolve, where we just can't afford, at 18% GDP, these types of treatments. Of course, I think that the devices that we've developed to date are tremendous because it allows for delivering medications in diseases such as macular degeneration and diabetic retinopathy, whereby these drugs cost $24,000 a year. So we can find even small, kinks for delivering those drugs that save the system money, and also restore sight to patients with such afflictions. It fits that economic model. But $24,000 a year in medications is a very niche type of story for a niche type of disease. As we go towards the 2020s and the evolution of healthcare and where we are from really the practice of medicine and going towards the science of medicine, where we can use not only kind of smart, low-cost wearable sensors to partner with physicians to improve our diagnostics, and maybe I'll talk a little bit more about our business model and how exactly we can fit in to wearable sector and partnering with large strategics and hospitals, whereby these $4 sensors and $20 patches that passively measure every sound and vibration of the human body really start to inform our compliant cloud algorithms transferring through your cell phone to get away from the paradigm of simply having patients report their symptoms and then seeing a doctor. By the way, it takes about 3 weeks to see that doctor these days for primary care. And then it's kind of a detective work for hopefully we can find out what those symptoms are. In these large paradigms such as diabetes or congestive heart failure, where you're not just one day diabetic, or you're not just one day atherosclerotic and have heart disease. This is a continuum. And so we can use other types of signs and symptoms, and specifically quantitative medicine, to measure and react early on before these patients have the symptoms and ultimately lead to, in the case of congestive heart failure, a $12,000 stay in the hospital. Our goal really is by partnering with clinical teams and digitizing this care plan. We early on partner with workflows and created this health selfie, where in 7 minutes we can use these sensors and ultimately create your baseline, and as instructed by the iPad or the cell phone, where to place these small wearable waterproof sensors to let the patient then allow us to follow you for 2 weeks and intervene early despite what disease is out there. So ultimately we are a data science firm that separates ourselves on our data science, and I have a tremendous team. And the co-founder, Dr. Shasha Jume, was in charge of one of the world's largest healthcare informatics programs, a collection of over 400 million people's data. But it's one of the things I think we're really solving is developing patches and clothing in order to get the right type of data, specifically for machine learning, that can allow us to kind of evolve healthcare into the next age, whereby you're not just getting 3 different diagnoses from 3 different doctors, but using quantitative medicine, partnering with your doctor, freeing up his or her time to provide more of the humanistic side of medicine, yet strategically giving a good care plan and changing medicine and your personalized medicine care plan together.
Thanks, Sean. So let's shift a bit over to Bruce. And Bruce, I'll let you describe yourself a bit, though. You were the largest TPA in Canada or just in Ontario?
In Canada.
In Canada. Do you all know what a TPA is?
It's a third-party administrator.
Which is?
So, we manage health benefits.
And now you're with benefitsEQ.
Private corporations. So, why don't I'll take it from here.
You will? Okay, I'll back off of that.
Yeah, there you go. I can handle this. So I just have to say, I don't know if everybody feels the same way, but between, I mean, some of these seminars today, I think I'm dizzy because some of the information that I've had to take in today, I really is going to underline some of the things. Sorry, some of the things I've been looking at in terms of where I've been going with my business. So what I've been trying to do today. So I was a plan administrator in the insurance business. I sold that business, and for the last 5 years, I really haven't been doing too much. But I did have a connection to wellness over 25 years ago. We had embedded wellness, nothing compared to what's available today, but we have embedded it as part of the value proposition to our clients. So we did have some exposure to it. And my wife was tired of me. She said, "You better get out and do something." So I started to look back at the wellness field. And attending here today, and seeing all the different verticals and all the different solutions really supports where I've been. And what I mean by that is, when I look at a business, and I look at it from an employer point of view, I always start there. And you always want to be trying to provide a service that you can quantify value. And clearly wellness has had some difficulty in quantifying value. And I think the reason for that is because there are multiple platforms. So we're going to talk a little bit today because Dennis had asked me to talk about AI and how it can impact the delivery of wellness. So maybe we can, or I can do this actually. I think I can do this. Which one do I press? Here we go. So the first thing that you just look at, with everything we seem to be doing, we still have a situation where 80% of all chronic conditions are lifestyle related. You're the doctor here, right? So something is absolutely broken if we can't seem to resolve that. And so there's a couple of observations that I've made in talking to employers. One is, employers tend to be focused on short-term results. They want to get to the low-hanging fruit. They want to reduce costs in any way they can. But the danger of being focused on short-term results is you're not really taking a longer-term view. But you know, it's interesting today because we've had a lot of speakers, and they've been talking about issues that are honestly outside of the purview of an employer. For example, they're largely public policy decisions that would drive changes in healthcare behavior. Unfortunately, I don't think I have long enough to deal with public policy issues. Maybe some of the younger ones here do, but I think I'll finally be retired long before that gets resolved. But the one thing I would say to employers today that are deploying digital wellness platforms and looking for short-term ROI is the value may well be hidden, which is that it's data aggregation. It's an opportunity to gain data and start and hold on to that data, which will give some indications on lifestyle. And that data related to lifestyle, I believe, has great value in trying to understand on how best to connect with people and get them motivated to make changes in their life. That's not happening now as much as it should, but I would also say, as an employer, and I know not all of you are employers here, that providing tools and services to those who want to use them is a value proposition. So there may be a discussion to be had about how to bring that value in terms of the model. But nevertheless, I think that if you have employees that want to take advantage of those tools, certainly providing them is an important thing. But the one thing that's interesting, I'll share this story. I've spoken to employers with 20,000 employees, 25,000 employees, and if you're talking to the market, they talk about ROI. But when you talk to those employers, very few of them are measuring ROI in any meaningful way. And the reason for that is they aren't benchmarking. They aren't really collecting the data in a way that they can benchmark it. So health risk assessments, taking advantage of some of the wearables, looking at that data, maintaining it over a period of time, they really aren't doing it. So they talk about doing it, but they really aren't doing it. Now, this one is one, actually, it was interesting. I just was in another seminar, and to me, this is the missing link. I think it's the integration of the primary care physician within the whole wellness universe. So what we have today is, let's face it, when you see a doctor, if a doctor's working with you, it's because you're sick. But the primary care physician certainly has a role of trust to impact the way people behave in their lives and get them to modify their lifestyle. So, you know, I could take a personal example. I went to see my doctor and she said, you know, your cholesterol's a little bit high. Would you like me to write you a prescription? So I said, well, and I don't like to take medications for no reason, just because they're prescribed. So I said, well, if I just stopped eating, you know, 3 cheeseburgers a week and did some exercise, would that do the trick? And she said, yeah. So I said, well, I'll go with that one first. But that doesn't work for a lot of people. A lot of people would just take that medication. It's a simple solution. So there's an example where the doctor could have come forward first and said, look, you need to change a few things in your lifestyle. They didn't ask me much about my eating habits. They didn't ask me about how much I exercise. So for me, one of the things that I'm looking at and trying to be honest with you, to figure out, and I think there's a lot of promising concepts here, is how do you loop the doctor into the process? The reality is they don't get paid to do it. They don't have the time to do it. They don't have the inclination to do it. And frankly, they sometimes think it's beneath them. But ignoring lifestyle, you know, is really, it's the hallmark of preventive care. If you can get people to eat better, to exercise more, to be more aware, to be more educated about their health, there's strong evidence that they are going to be healthier and you're going to get healthier outcomes. So that to me is one of the things that I'm focused on. And I think it's interesting because I was watching the other seminar and they said, well, we asked doctors if they would do it, if we gave them the data on lifestyle, would they look at it? And they said no, they're not interested. They don't want to do it. So part of that ultimately is going to be behavior change. And what I mean by that is, you know, outside of the public system, employers are the ones who are footing the bill for healthcare. And so I think, you know, I'm thinking about how can employers create an environment in which the doctor would actually adhere to providing more information on wellness. So bottom line is, you know, it usually comes down to paying them for those services. I'm not sure about that, but at the end of the day, I also think it's also about creating or closing the gap between the doctor and the patient by putting in place the resources that would be levered based on the doctor's recommendations. So in other words, if the doctor said, Bruce, you really need to, I don't know, walk 10,000 steps a day, you need to start eating better, you need to cut this out of your diet, you know, maybe there's some other recommendations, maybe you do have to take some medication. It seems to me that, you know, the doctor should not only find out whether I've done that when I do my next annual checkup. There should be some feedback throughout the course of the year that allows the doctor to at least know what's going on, but to fill the gap in terms of getting the patient to adhere to it, there might have to be another subset of clinicians or practitioners that would work with the patient. So You know, in no particular order, there is no silver bullet. That's one thing I've absolutely learned today. And if people think there is, they're wasting their time. There's so many different factors that are affecting the cost of healthcare in the workplace. So, or at least from an employer perspective. I mean, we just walked in, there was a lady here who was speaking about the importance of, providing care to elderly parents in the home. And she was right. When you look at studies, that alone has a big impact on employers because employees have to take time off or they have stress or they neglect their own health when they're actually responsible for another person. So where I see the opportunities in terms of AI, and I think they're somewhat undervalued, is I think AI in taking data can start to look at and can start to take that data and start to disseminate it in a way that I think can change behaviors, not just of the patient, but of the actual medical profession. So I'll give you an example. I know there's a lot of services that will look at doctors and try to help them, engage better or look at how they operate their practices. But if AI told me right now, which doctors already are at the highest level in terms of both efficacy, so outcomes, and cost, and I provided that information to an employer, and the employer drove their employees to those doctors in largely a capitalist system, then either other doctors would have to adjust their practices to reflect those higher care levels, or lose the business. So that might, in the end, be the only way to do it. So that's a huge opportunity for AI, where big data sets can actually identify those inefficiencies in the system. So we can go through a lot of steps to get people to navigate the health system, to find the right doctor. Instead, we can just use AI to tell us who the right doctor is in the first place. So, I think I was already ahead of myself. So AI will empower people to identify and support diagnosis, and decision making. AI will leverage medical data to support doctors to optimize treatment, so that's what I was just talking about. AI will be able to look at each individual's health profile, looking at a broad spectrum of inputs such as demographic, social setting, family history, activity, current state of health, to drive predictive health modeling for every individual. So this has all been talked about today. Depending on where you live, your health outcomes will be different. Obviously, your family history, your health outcomes will be different. Your habits will have impact on that. Where you work will have an impact on that. So we talk about personalized healthcare. AI has the promise to take that data in, start to understand that, and over time learn what models seem to work best for each individual based on their profile. Of course, AI will be able to measure treatment outcomes against large data sets and refine best practices to optimize results. So again, that goes back to my point that if you're looking at large data sets and you're seeing that certain doctors are getting better outcomes in terms of treatment, in terms of treatment, then you start to be able to map that, and actually that information can be used by other doctors within the same field to improve their practices, and they'll be able to learn much quicker. So it won't be just about reading a study from Harvard or going to a conference. These will happen in real time once AI data is starting to rock and roll. AI will help people based on the persona to select insurance coverage best matched to their health profile. So a lot of decisions are made based on what people can afford in insurance, and oftentimes they don't know what type of insurance they should be buying. So AI support tools will do that. They'll go beyond just sort of a rudimentary selection. They will be looking at your persona. They'll be looking at all those other elements within your profile and help you to make a better decision in terms of the type of health insurance you're purchasing, and actually be able to tell you based on your health profile, what your cost would be 5 years out, and do predictive modeling.
AL will allow health and insurance providers to deliver highly customized products and services aligned to each individual's persona. So there's going to be a time and place. Certainly it's ongoing already. Consumer-directed healthcare is really a shifting of costs back to the individual. So the individual will also, at the same time, want to have products that are more suited to their actual health needs based on their health data and all the things we've talked about, or I've talked about. So this is an example that I put together. So it's data and signals, it's profiling and behavior models. You target content, actions, and programs, and you personalize content and plans. So it starts with the data. It's able to do the profiling and understand your behavior based on all the inputs we've talked about. And those inputs can come from multiple places. Your social activity, some of the wearables, your health records, your family history. All those inputs will result in a persona. And from that persona, you start to, AI can start to better understand, based on the actions you take and the programs offered, whether you're responding to those programs and adjust over time. It's a learning technology. So it will learn what approaches are going to better impact you and get you motivated. And that in the end will result in personalized content, so that would be information and access to programs that are best for you. So, actually I want to go back for a while. Oh yeah, so AI has the ability to take on a large data sets from disparate sources and support actionable decision making. That's basically it in a nutshell, but this is something that I've thought about quite a bit, and I think one day everybody will have a health score. So think of it, are any of you have those driver apps that when you drive around, if you drive well, you can get discounts on your insurance? Does anybody have that here? Oh really? You're all terrible drivers. I have it.
It must be a Canada thing.
Maybe. Anyways, I have it. But so here's the deal with that. So how it works is, I get the baseline insurance just like anybody else based on my public record, or my record of never having an accident. But if I actually show them I drive better, they will give me discounts. So I can't go below that, but I can't be re-rated because they found out I was going 110 miles an hour in a 50 mile zone. But if I do drive at 50 miles an hour in that 50 mile an hour zone, they actually give me a little message saying, you've got a new start today. And over time, I start to get discounts. So I can see that model being applied to people's health, where it won't be where you can be rated and charged more, but it could be that if you do follow certain health behavior and you achieve it, you can actually have a health score. And part of that also relates to health privacy. So one of the issues for people sharing data, and for good reason frankly, is that they're afraid that their data is going to get exposed, regardless of all the encryption methods that people are talking about. People are afraid it's going to be shared with their employer. They're not sure where it's going. Now, certainly the movement in that area is that more and more individuals have control over their health data. But the bottom line is health data does get shared, even if it's an aggregated form. And if there's any time something's open to sharing, there is some opportunity for that data to get out into the wrong hands. So one of the concepts I've been looking at is basically that if we can assign a health score to people, so this is on a different level, we're not talking about to your doctor, giving your health score to a doctor, but certainly for insurance coverages, that may be one way of doing it without providing too much information to the insurance company that the individual may not want to provide, such as genetic testing is a good example. So these are some of the things that I've seen, and some of these are underway right now. It's not just me talking. Basically my experience is I'm talking to a lot of companies. Some are actually here today, but there's a lot of innovation going on right now, both in Canada and the United States, and AI is starting to really ramp up. I would actually say within the healthcare framework, the industry is at a tipping point. In the next 5 years, we're going to see a lot of complete change in the way lifestyle management is delivered within the employer market.
Thanks very much.
You're welcome.
John, would you like to add something?
Sure, yeah. Nice talk, and I agree. I think that there is no one silver bullet, and what we're facing in over the last 200 years in healthcare is a lot of small, iterative improvements, and that's mainly based on we benefit as physicians in classical training. We measure pulse today because they could 200 or 300 years ago. We measured heart rate and auscultation today because the stethoscope was designed 200 years ago. We kind of we accrue all of this data and all of this essentially teachings, and we're at a point now where the system has to change. It has to change because we can no longer afford the costs. Chronic disease, while improving compared to 25 years ago, there's great fundamental paradigms and that we can look towards other industries, such as the automobile industry. And I want to just kind of comment that, over the course of 1 year, the average data that your primary care physician collects from you today is about 200 megabytes. It includes your x-rays, maybe some files, a couple audio notes. Whereas, people driving around in the valley with a Tesla, in 1 hour, this Tesla is essentially processing 25 gigabytes of data. And if you look at kind of where medicine is, and we're not yet kind of fully embraced in this fourth industrial revolution. And we need, and we will catch up, no question, because what we learned from automobiles and kind of check engines is we do need to ultimately find new ways to not only understand where we are in our healthcare, but I think an important part is the data itself, and that needs to be owned by the people. And essentially this kind of concept of democratization of health that is crazy, that most states, almost 49 states in America, do not allow, or do not, it's not the law that patients own their own health care, their own data. In California, the hospitals own the data, or in many states, the doctor owns the data. I think that we can leverage, not only with small portable devices in our pockets, but also leverage familial support to use these tools. And it's going to take that type of fundamental change, maybe not from inside the healthcare system, but companies like Amazon that are getting into this sector, or even CVS is acquiring it. Now there's big changes here, but ultimately it's going to take the familial support and individual patients to announce and insist that there's no such thing as an average patient. We're trained in medical school that 20% of these patients are going to react well to this disease, to the red pill, and 80% will react poorly to the blue pill. So therefore, I'm going to describe, you come in with some symptoms, I'm going to prescribe you the red pill. There's no such thing as an average patient. And I think we can use these tools to ultimately define the individual side of medicine and understand who you are, how your body works, and from these tools that are lower cost, and by really enabling the patient with these modern tools. Data privacy is an incredibly important topic for perhaps another panel, but that's going to lead towards a huge generational leap. Like I said before, we can get away from kind of this practice of medicine and go more towards the science of medicine.
So Sean, let me push that a bit, okay? So part of our title is New Frontiers. And your suggestion is we really need to think differently, and that we need to approach this in a different way. And so much of what we do in medicine has been unintelligent. We see intelligence in automotive, we see it in aircraft, we see it in manufacturing, and so many other areas. In fact, one of our general session panels coming up is going to be on cross-industry approaches to how we deal with innovation. So if we have this ability to bring intelligent AI to the fore, that learns and can respond and so on and so forth, what do you see as being the primary components to open up the new frontier? how do we get beyond recalcitrance? And let me not even talk about silos, because I was recently at a talk where someone was talking about silos. And on the farms, they don't even use silos anymore because it's too expensive to push the grain out. Thinking silos is the wrong method. So we really need to rethink. You have a lot of vision. You've done something really transformative. Where's the future?
Well, I think the approach really needs to be leveraging a multidimensional viewpoint of including, starts with the doctor, but freeing the doctor up from any of the kind of daily activities that can be done today by other care providers as well as other diagnostic tools. I think by leveraging textual analytics with, so we're essentially in between textual analysis and image analysis with our sensors, and ultimately to approach systems biology from an IoT perspective. And that is a combination of connected, low-cost devices that feed into a more centralized AI analytics platform, but it makes it simple for not only the patient and provider to understand, and it can be in the form of a wearable sensor, but ultimately empowering the patient to own their own data and to not just wait 2.5 weeks for a primary care physician, but to use these, Google tools, Amazon developing healthcare tools as well, to partner and make more, kind of use these tools to create and leverage actionable insights in their own healthcare. Include the doctor as part of that care plan, but as consumers and patients kind of merge together, we're going to have to start to embrace kind of this digitization of our own symptoms, digitization of our healthcare records. AI is going to be a big part of that, especially if it's done responsibly and economically. And we need to do this on a scale that is disruptively less expensive year by year. Instead of
I like that, disruptively less expensive. That's good stuff. Do you want to add anything, Bruce?
No, Sean, you did a great job. I should have had you present. Thank you. No, the only other piece of it's going to have to go beyond wearables. So the individual needs to be on board. That's the bottom line. And it's kind of interesting because I don't think you'd ask anybody. It doesn't matter whether they're overweight, whether they're smokers. They would all tell you they'd like to quit smoking or they'd like to eat better. So there's impediments that have to be understood at the behavioral level. And so they need to participate in that.
Don't each of us have the ability to be a victim or a vanguard? I mean, why do we buy into that? You're talking about health care, I'm talking about health, and you're talking about way to structure benefits to make that happen. I mean, to me, the foundation of all the ability to have access to so many of these things is to empower the person to have some control over their destiny. Not to be a victim to the system, to be a vanguard.
And this again, I think this goes to where AI is going to change things.
I think so as well.
I really do. Because it's going to give everybody in this room the power.
The capability and the ability.
On the phone, literally, on their phone, to really make better decisions, but it's also going to improve medical practices.
Exactly. Let's throw this open to some questions, please. Right here.
How, and this question is to both of you.
Would you give her the mic, please?
This question is to both of you. How have you looked at, or are you looking at, incorporating blockchain into both of the models that you're talking about, so that whatever is out there can be secure, that my health information isn't going to go off to the life insurance company and other kinds of organizations. So what are you doing to make sure that in fact this very sensitive information will be secure?
So distributed ledger blockchain is going to be a big part of this for sure. So not that I'm an expert in blockchain, but I do understand it to a certain extent. You still have to be careful what data sets are put on the ledger. So you can break it up and only give the pertinent information that's required. But if I talk about it from an insurance industry point of view, so I'm not going to talk about it from medical practice side of it. That's where I think you're going to see, I believe you can use some rating systems to identify people without actually sharing any personal information.
Sure, anonymity.
Yeah, to ensure anonymity. So basically it's to create a scale. And on the flip side of the scale, there's parameters that are understood at the other side. But your actual personal information in totality isn't shared. So those are one way to do it. Now I see that more because I come from the underwriting side, so from the insurance side. Certainly if you need to share health information, that's a little different. I mean, there has to be a way to share the pertinent information with the other practitioner. I don't know, maybe Sean could speak to that.
Sure, I think you've got a great perspective from the insurance employer side. I mean, from the medical side, I would push away from kind of a digital health score or a credit score. I think that it's important to accrue all of this information for the patient, but I've got another perspective, I guess, from the patient-doctor perspective. I think that specifically for your question about the blockchain, is incredibly important to leverage where this is a great technology to allow patients to own his or her data. We're doing something I think incredibly innovative, however, in addition to blockchain, where our platform allows us to move the data science across firewalls and not the data. We can explain that maybe another time, but what this is essentially you can keep the data in the silos, but the data science allows us to look for those digital fingerprints, look for kind of those red flags that come up and allow us to either contact down to the cell phone provider, the patient or the doctor in order to indicate those red flags. But there are ways without having to move data or even share from the blockchain. Our platform really enables us to move data science across firewalls, and that allows us to scale our platform. It's very powerful and very exciting at the same time. I would embrace that data privacy is incredibly important, and the blockchain is a fantastic innovation towards that, and is going to be, I think, a key attribute towards the next, towards the future.
So Sean, what's the element that you feel that got Context Eye to win this NASA Innovation Award in light of the very thing you've just been talking about?
Well, I think it's the concept of this digital fingerprints, whereby we're able to leverage the personalization of each patient, and now we've now measured hundreds, almost thousands, by the end of the year, thousands of patients, where we're essentially able to identify a digital fingerprint that is specific to you, but also grouped to other patients with similar afflictions. And we're able to use these low-cost, smart wearables as a form of clothing, and compare that here on Earth, and how do those digital fingerprints change as astronauts go to low Earth orbit, or even longer, deep space. And
or below the water as well.
Or below the water. I think that's, from our standpoint, it's very interesting as we look at these digital fingerprints and are able to have our best be worn in space, where you can look at the delta, how they change, and leverage our growing number of patients, patient fingerprints here on Earth, and look at how they change and leverage all of that insights so that, in fact, cancer is not the number one kind of danger in space. It's actually cardiovascular, because the patients, the astronauts that went to the moon, of the 7 of them, most of them have suffered from cardiovascular ailments from the radiation, long before they can actually get to the oncologic aspects of it. So I would say it's our ability to leverage low-cost sensors and our data collection here on Earth to leverage that towards insights and kind of closed-loop medicine, and we have a great platform to do that.
Another question? Yes, please.
Thank you. There seem to be many entrenched interests who would prevent that disruption in any way they can, whether it's getting Americans more obese or so they can use more drugs. So how do you combat the pushback financially?
Before I respond, you're not suggesting we have perverse incentives, right? Okay,
We're
go ahead,
ruled
Joe.
by reverse incentives, I think, in America.
Maybe I can comment. Dr. Eric Kopel, as a big driver in this field, he made a great comment that we're going to need to have this change from outside the system. Asking doctors and hospitals to make these changes in healthcare is a lot like asking stagecoach companies to build railroads. And it's going to take really the ownership of data from patients and familial support and these novel tools to essentially understand that we're our own physicians and we're not an average patient anymore. We can understand how we're going to react towards patients, and the doctor's a really important part of that tool, for which Context AI, we want to partner with these physicians and clinicians, but they're now offer the ability to free up some time and provide more of the humanistic side to medicine instead of kind of this average 5 or 7 minutes per contact with the patient.
We have time for one more question. Varun?
I saw the idea of a health score floated at the end, and definitely I see some benefits for providers, insurers to see more insight as to how they're accurately charging their consumers. But can you explain what the win would be for the end user? And specifically, in my mind, it's not just about the money, right? The goal is to have them be more healthy. So if I'm, as a user, going to be more healthy and get a better health score, that's me doing my part. What if my health score doesn't improve while I adhere to your program? Do I get a credit back?
Okay, so I only touched on it lightly, so but good question. So so a lot of products are delivered. They're delivered without any health information. So there's a certain amount of insurance you can get without proving your health. So think of it in that context. So everybody's at a baseline right now. So I'm not suggesting. So there's some reasons you can't improve your health. I mean, if you have cancer, as an example, or you're genetically predisposed to a certain disease, that wouldn't be a fair part of your health score. But at the same time, and maybe a health score is a bad way to call it. Maybe we should call it a healthy lifestyle score. The insurer, in terms of the context of an employee-employer relationship, their time horizon is until you're 95 years old. You're going to work till you're 65, if not less. So that's really the time period they're worried about, and that's the time period they want to maintain you to be healthy. So the health score might be one way of motivating people to actually, improve their lifestyle in return for either receiving access to more insurance without having to prove insurability, discounts on their insurance. So that's what I'm referring to, and they can do that without sharing any personal information beyond the fact that they fit in a broad criteria.
And you would want to tailor those incentives to an individual person.
Right.
Right, but that's
So, John, thank you so much.
Okay, you're done. All right, no worries.
We've allotted our time, so thank you so much.